We call upon the federal, provincial, territorial, and Aboriginal governments to commit to reducing the number of Aboriginal children in care.
We call upon the federal government, in collaboration with the provinces and territories, to prepare and publish annual reports on the number of Aboriginal children, First Nations, Inuit, and Métis, who are in care compared with non-Aboriginal children, as well as the reasons for apprehension. The total spending on preventive and care services by child welfare agencies and the effectiveness of various interventions.
We call upon all levels of government to fully implement Jordan's Principle.
We call upon the federal government to enact Aboriginal child welfare legislation that establishes national standards for Aboriginal child apprehension and custody cases.
We call upon the federal, provincial, territorial, and Aboriginal governments to develop culturally appropriate parenting programs for Aboriginal families. We call upon the federal, provincial, territorial, and Aboriginal governments to develop culturally appropriate early childhood education programs for Aboriginal families.
We call upon federal, provincial, territorial, and Aboriginal governments to acknowledge that the current state of Aboriginal health in Canada is a direct result of previous Canadian government policies, including residential schools, and to recognise and implement the health care rights of Aboriginal people as identified in international law, constitutional law, and under the treaties.